Can breast augmentation affect breastfeeding after surgery? Many women wonder if breast augmentation will impact their ability to breastfeed. This concern is quite common and worth discussing. Breast augmentation is a procedure that enhances breast size and shape using implants. The effect on breastfeeding largely depends on the surgical techniques used and the placement of the implants. One important factor is the surgical approach. Incisions made around the areola, known as periareolar incisions, can potentially damage milk ducts and nerves that are crucial for lactation. In contrast, incisions made under the breast fold or through the armpit are less likely to cause such damage. This is significant because any injury to the ducts or nerves can affect milk production and the ability to let down milk. Another factor to consider is where the implants are placed. Implants can be positioned either under the chest muscle or directly behind the breast tissue. Submuscular placement, which is under the chest muscle, is generally less likely to interfere with the milk ducts and breast tissue. On the other hand, subglandular placement, which is behind the breast tissue, may compress the ducts and glandular tissue, possibly leading to complications in breastfeeding. Preserving breast tissue is also vital. The more glandular breast tissue and ductal systems that are kept intact during surgery, the better the chances of maintaining milk production. If too much tissue is manipulated or removed, it can reduce the ability to produce milk. Nerve integrity plays a role as well. Sensory nerves around the nipple and areola help stimulate the letdown reflex necessary for breastfeeding. If these nerves are disrupted during surgery, it may lead to difficulties in breastfeeding. Clinical evidence suggests that many women with breast implants can successfully breastfeed, particularly when the surgery is performed using techniques that minimize disruption to the milk ducts and nerves. However, individual experiences can vary. Some women may find they have a reduced milk supply or face challenges with breastfeeding, depending on their specific circumstances and the details of their surgery. In conclusion, while breast augmentation can potentially affect breastfeeding, the extent of this effect varies. Choosing surgical methods that avoid damaging milk ducts and nerves, like using inframammary incisions and submuscular implant placement, can reduce risks. Women who plan to breastfeed in the future should have a thorough discussion with their plastic surgeon about these concerns to tailor the procedure accordingly. Personalized advice from qualified professionals is essential for the best outcomes.